5 different labs that are used to indicate fluid volume deficit include an increased hemoglobin and hematocrit, increased serum and urine osmolality and specific gravity, a decreased urine sodium, an increased BUN and creatinine, and an increased urine specific gravity and osmolality. Electrolytes are charged ions that are dissolved in body fluids. Their purpose is to maintain cell excitability and allow for the transmission of nerve impulses. They're basically active chemicals, and they include cations, which are positively charged, and anions that are negatively charged. Major cations in the body are sodium, potassium, calcium, magnesium, and hydrogen. And the major anions in the body are chloride, bicarbonate, phosphate, sulfate, and proteinate ions. There are different reference ranges for each of the electrolytes in the body. The sodium ranges from 135 to 145 milliequivalents per liter. Potassium is 3.5 to 5.0 milliequivalents per liter. Magnesium is 1.8 to 3.0 milligrams per deciliter. Calcium is 8.5 to 10.5 milligrams per deciliter. Chloride is 98 to 106 milliequivalents per liter. And phosphorus is 2.5 to 4.5 milligrams per deciliter. The signs and symptoms of hypernatremia include hyperthermia, tachycardia, excessive thirst, restlessness, orthostatic hypotension, irritability, decreased or absent deep tendon reflexes, coma, and seizures. The signs and symptoms for hyponatremia include tachycardia, hypothermia, hypotension, headache, confusion, lethargy, decreased deep tendon reflexes, nausea, dizziness, and seizures. The signs and symptoms of hyperkalemia include diarrhea, intestinal cramps, muscle cramps, weakness, paresthesia, and in very severe cases, cardiac arrest. For hypokalemia, polyuria, muscle weakness, abdominal distension, polydipsia, paralysis, cardiac arrhythmias, and paresthesia are all symptoms and signs. For hypermagnesemia, the signs and symptoms include a flushed appearance, bradycardia, hypotension, heart block, drowsiness, confusion, diminished reflexes, and facial paresthesia. For hypomagnesemia, it includes apathy, depressed mood, hyperactive deep tendon reflexes, paresthesias, seizures, agitation, positive Chavostics and Trousseau signs, and constipation. The nursing care and management for hypernatremia includes monitoring the level of consciousness and ensuring the patient's safety. It also includes providing oral hygiene and other comfort measures to decrease thirst, monitoring in and out, and auscultating lung sounds. For hyponatremia, the nursing care includes sodium replacement by either oral or IV routes. Water intake should be restricted per the provider, and sodium-rich foods need to be taught to the patient. The nursing care and management for hyperkalemia includes preventing falls, assessing for cardiac complications, teaching the patient to avoid foods that are high in potassium. And these foods can include lean meat, eggs, milk, coffee, and citrus fruits. Nursing care and management for hypokalemia includes assessing for phlebitis when administering potassium, observing for shallow breath sounds, assessing for muscle weakness and deep tendon reflexes, and encouraging foods that are high in potassium, which are those citrus fruits, broccoli, avocados, lean meats, that sort of thing. The nursing care and management for hypermagnesemia includes providing sufficient fluids for adequate hydration, and administering IV fluids, assessing deep tendon reflexes for new hyperreflexia or continued hyporeflexia, and teaching the patient to avoid foods that are high in magnesium. The management for hypomagnesemia includes discontinuing the magnesium depleting medications such as loop diuretics, administering oral or IV magnesium sulfate while also monitoring the deep tendon reflexes, and encouraging foods that are high in magnesium such as nuts or dark green vegetables. When a nasogastric tube is attached to low intermittent suctioning, the nurse should monitor for both hypokalemia and hyponatremia in the patient.